Finding a uniquely American solution to ensure that all Americans have access to meaningful, affordable health coverage has been an unfulfilled goal for decades. Today, we have the opportunity to make this moral and economic imperative a reality. The Affordable Health Care for America Act meets the goals of health care reform, enhance consumer protections for those with health coverage, new affordable choices for individuals and small businesses, strengthen Medicare for our seniors with better prescription drug coverage and access to primary care, improve delivery of services with better health outcomes for all Americans, and containment of the rapidly rising costs of health coverage. It builds on America's public-private system, and it is paid for now and into the future. The status quo is unaffordable and unsustainable. Health care reform benefits all of us, families, seniors, businesses, and the nation. I am honored to have been a part of bringing this bill to the floor to this historic moment, and I look forward to voting for this landmark legislation and meeting the goals of health care reform for all Americans. Now is the time to act.
For what purpose does the gentleman from Pennsylvania rise?
I have permission to address the House for 1 minute.
The gentleman is recognized for 1 minute.
As we are about to deal with this health care bill before Congress, many of us have still attempted to try and improve the bill. I offered 2 amendments to the Rules Committee last night, and they were rejected. One of them was to say before we cut $500 billion out of Medicare, maybe we ought to fix it first. There's a great deal of savings which would come from Medicare if we use scientific evidence-based medicine as established by the specialty academies for colleges of health in areas to help improve chronic care conditions and deal with many other improvements. That was rejected. Instead, we'll cut the money from Medicare. The other one makes sure that if the Senate should move forward with their provision of allowing states to opt out, they should also be able to opt out of paying taxes. In other words, we should have no taxation without hospitalization. Instead, my fear is that taxes will remain to the point where it's going to cost our economy more jobs and cost our small businesses more. There still is much to do in this bill, and it is not yet ready. And I still hope that there is time in the coming weeks we can improve these bills and work on real health care reform.
For what purpose does the gentleman from Oregon rise? The gentleman is recognized for 1 minute.
Thank you, Mr. Speaker. One of the strangest sights, and now a symbol of the health care debate, was the red-faced protesters egged on by my GOP colleagues to keep government out of their Medicare. These people aren't ignorant. They are uninformed and unfortunately purposely misled by some on the other side of the aisle by Republican talking points that deny government can have a constructive role in health care, even as they rely on government for health care for seniors, veterans, emergency services, and, of course, for themselves. When most Americans are given the facts, they are pleased that it is now time to take the next steps beyond our citizens, our seniors, beyond our veterans, beyond emergency services, and of course beyond members of Congress. Today we can extend those benefits to more Americans while we protect those with insurance from abuse and reform Medicare in trouble. Americans await Congress to take these next critical steps to give Americans the health care they need and deserve.
For what purpose does the gentleman from Texas rise?
Request permission to address the House for 1 minute.
The gentleman is recognized for 1 minute.
Mr. Speaker, the federal government promised to save the country by providing 120 million H1N1 virus vaccines in 3 months. Of course, the government only made 20% of that number on time, so the government had to decide who would get medicine and who would not. Wall Street special interest groups got their shots, but vaccines didn't go down the street to hospitals for children and pregnant women, the most vulnerable. The feds are also giving criminals in prison and even the terrorists at Guantanamo Bay prison flu shots, while Americans who have committed no crime get to the back of the line. This simple shot program administered by the government is a mess and has its priorities wrong. Why? Because the government's in charge. The government decides who gets flu shots and who doesn't. Patients don't decide. Doctors don't decide. This is what a universal government-run and government-rationed health care program looks like. Welcome to the future, and get to the end of the line. And that's just the way it is.
For what purpose does the gentleman from Oregon rise? The gentleman is recognized for 1 minute.
The big insurance companies and their Republican allies are bitterly opposed to health care reform, and I understand their opposition. This bill will outlaw the worst and most lucrative consumer abuses by the insurance industry. It repeals their unfair antitrust immunity. No more collusion and price fixing to drive up your premiums. It outlaws the pre-existing condition exclusion. It outlaws them from canceling your policy when you get sick, a common practice in the insurance industry. And no more small print lifetime caps that drive families to bankruptcy. It improves Medicare coverage for all Americans and improved Medicare reimbursements for Oregon seniors and disabled. The Republicans would have none of that. In fact, they open new loopholes for abuses by the insurance industry by allowing them to base their national plans in the new state of the Northern Mariana Islands, which they've designated in their alternative. So when you have a complaint, you can call Jack Abramoff when he gets out of jail, and he'll help you with your insurance problem. That's the Republican plan. Our plan isn't perfect, but it's a good start toward providing affordable health care to all Americans.
For what purpose does the gentleman from Georgia rise? The gentleman is recognized for 1 minute.
Mr. Speaker, the American people need to know what this debate's all about. On one hand, it's a complete takeover of the health care system that the Democratic Party is proposing. On the other hand, Republicans have offered alternatives to let the patients make decisions. In fact, I offered H.R. 3889, which is totally private, doesn't raise taxes or anything else. Their plan will destroy the economy. It will put 5.5 million people out of work. It's going to destroy the doctor-patient relationship. A government bureaucrat's going to be making decisions for every patient. The American people need to understand this is about a government takeover of the whole health care system. They need to call their congressman and say no to the Nancy Pelosi steamroller of socialism. I'll yield back.
For what purpose does the gentleman from Washington rise? The gentleman is recognized for 1 minute.
Mr. Speaker, health care is not a frivolity or a recreation. It is life itself. To a woman with early onset breast cancer, health care is life itself. To a child with juvenile onset diabetes, health care is life itself. It is well that we reflect on how we founded this union. We believe that all men are endowed with certain unalienable rights, that among those are the right to life, liberty, and the pursuit of happiness. We pass health care to honor life, not just on parchment, but in practice. We pass health care because we cherish the lives of all Americans, not just our own. This is an American step in progress. It is an American right to life.